All right, and we are live. State Senator Dan McConchie is here from his home. I am here in Palatine. Thanks again for tuning in. Obviously, the last several weeks have been very, very busy. Dan, I've been watching some of your material, and you want to just give a quick rundown of the sort of calls that you've been getting to your district office, or the sort of things that you've been busy with.
Sure. Well, it's good to be with you today, Tom. There's a lot of people out there very concerned on a whole number of fronts, right? We have issues both in regards to health, how people can get appropriate testing if they feel that they're sick. What are they going to do? How do they get unemployment insurance coverage that has been promised both by the state and federal level? What if they're a private business and are looking for some sort of help and support to try to help keep employees on or just keep their doors open? It's really tough for lots of people right now, and so it's a challenge. I just want to thank everybody for their, how much they've been willing to really kind of step up during this difficult time, but then also to express to me as well as your other elected officials things that you're unhappy about, things that you think should be different. This pandemic is not something that we planned very well for, that we saw coming, that we thought, we expected to happen this year. Obviously, it took the vast majority of people by surprise. And so trying to react, trying to figure out how to operate in this new environment is a very difficult challenge for all of us.
One of the reasons why we want to do this, so Senator McConchie has filed legislation, SB 3987, dealing with the governor's executive order authority. This has been a hot topic in my district. I assume that it has been in yours as well. And so I wanted to get some public feedback on that. Stay in place executive order. It's obviously impacted not only businesses, it's impacted schools in our community across the state. Even medical procedures. I've been on the phone over the last days and weeks with dentists and other, oral medical professionals who have their business severely impacted. So it's affected a lot of people. And one of the fundamentals of our system of government is that we have co-equal branches of government. We've got an executive branch, judicial branch, and obviously legislative branch where you and I serve. And a question that came up in my mind several weeks ago is, okay, the governor has the authority to do this, but what happens if a governor, or either the current one or future, overreaches on this issue? Then what? And so I've at least been asking the question, and you actually put pen to paper and actually filed legislation. So give me a rundown of what your legislation would do.
Sure. So current law, what that does is it allows the governor to establish a state of emergency. So what he does is he determines a certain geographic area, and then for up to 30 days, he can exercise emergency powers within that geographic area. So what was largely considered at the time when this was first put into place was things like floods, tornadoes, massive fires, things of that nature that had a specific geographic area. Well, what happens is comes along a pandemic and that essentially affects the entire state. It doesn't affect it equally. Certainly more populated areas had greater risk than others. Chicago got hit earlier than in Metro East, earlier than our more rural areas of the state that don't have international airports and travel and so forth coming through. And so what he did was the governor created a state of emergency for the entire state for 30 days, and then has done a one kind of subsequent proclamation since then, and has already indicated that he plans to issue a third one coming up here at the end of the month to extend all the way through May. Now, there may be the ability of the judicial branch to be able to weigh in on these things. There's been one lawsuit downstate by State Representative Darren Bailey, who's challenging the governor's legality of ongoing declarations without any sort of check and balance on that. And we'll have to see what happens as that winds its way through the courts. But in the meantime, what our system of government was established with three co-equal branches: the executive branch, the legislative branch, and the judicial branch. And right now, here in the state of Illinois, the legislative branch has zero input in regards to what is happening in the governor's state of emergency declaration. And so what I did was file legislation to says that any subsequent declaration after the first one, right? A situation comes up, we understand the governor needs to issue a state of emergency and begin to do action on things immediately as soon as a tornado hits, as soon as a flood hits, and so forth. But that if an emergency goes beyond that 30 days and he needs to issue or feels the need to issue a subsequent declaration, and you have to understand, these declarations provide broad powers, broad unchecked powers for the governor to exercise alone without any oversight. What this legislation would do is that say subsequent declarations, which essentially draw the rules, right, about how behavior would happen within that geographic area. The stay-at-home order, what is how life is supposed to be lived, what businesses can be open or closed. He is doing as a part of those executive orders. And what I've said is that in this legislation would do is after that first 30 days, those state of declaration, that state of emergency, that declaration, the rules that would govern the freedom of people to be able to move around, do commerce, meet together, need to have the General Assembly essentially weighing in upon that. So what it would say is that when he files any subsequent declaration, within 5 days, the legislature has to either approve those or reject them or negotiate something different, just to be able to provide that balance of power that we have typically within government and should exist regardless of the state of emergency.
Yeah, and that's an excellent point because, again, the best kind of governance is that which is most local. I mean, we don't want a overpowerful government from Washington, D.C. dictating a one-size-fits-all approach to all of the states, all of the cities, the counties, et cetera. And likewise, you don't want a state government dictating to those local government. In certain areas, yes, that's legitimate, but the circumstances on the ground across the state are very, very different. I mean, Illinois could be one of the most diverse states among the 50 states in that we have an urban center, we've got a large suburban demographic, but then we also have a huge rural component of our state. And what we've seen in this pandemic is just, this has affected our state in very, very different ways. If you have a very dense population, you have residents who are using the same, for example, in a high rise, they're all using the same elevators, they're all using the same lobby. There's a much greater likelihood of transmission of a virus than there would be in a suburban setting or in a rural area. Obviously, the virus is going to infect a person regardless, but it's just the risk is different. And the types of businesses that operate in a rural setting versus suburban versus urban are different as well. And so I think some of the Republicans on the House side and the Senate side have been saying, look, the governor needs to acknowledge these differences. And now that we've got more data, we have seen where there has been, where the hospitals have ICU thresholds met. We just have to take a more nuanced approach as we go forward. Any thoughts on that?
Well, absolutely, it's a case that one size doesn't fit all. I grew up. My dad was born downstate on the Illinois side of the border where Terre Haute, Indiana is. Very rural area. There's areas of the state, whether down there or in the western part of the state, where they'll have 1 case, 3 cases, 8 cases in a county. These places need to be able to continue to operate because it's not only about the virus, right? It is also about the fact that keeping people at home, not allowing for commerce to go forward in those places in which it's safe to do so, and not treating businesses equally. I mean, why is it the fact that I can go to Walmart right now and I can buy groceries, I can buy clothes, I can buy furniture, yet I can't go to a furniture store, I can't go to a clothing store, even if those businesses are not allowed to open up, even if they were to operate safely. And so I think we need to get away from this kind of concept of, quote, essential versus non-essential, and really get more to a concept of any entity that can operate safely should be allowed to do so. We are crushing individuals. We're crushing small businesses. We are crushing business owners. We're crushing restaurants and bars. And in a lot of these places, there are entities that could operate safely and not only be able to provide work for people that need to, provide services for people that need to, but also provide necessary tax revenue that needs to come into the state so that we are able to have the funds necessary to, keep hospitals afloat, buy the PPE that's necessary, and really be able to respond to the crisis as it is currently unfolding and needs the state to be able to afford to intervene with.
Right, and that's we've talked. I've done a number of interviews with a local physician that works at Northwest Community Hospital, and so we've talked about the medical impact. But now I'm starting to see some other messages, and I don't know if you're getting this as well. But the mental health aspect of how much longer is this going to go on? The economic impact that is severe in certain cases. It's a very what I hope as a state legislator, and I think you as well, is that the governor is looking at the totality of the situation from an economic perspective. It seems like so much of what his decisions have been on the virus transmission rather than the totality. Do you have those thoughts as well?
I'm definitely concerned about that. I mean, obviously, when you're responding to something like a virus like this, which is very dangerous, it's very communicative, and has very significant downsides, obviously, for many of those people who contract it. We have to recognize that is not the only thing, right? There are, if someone loses their job and is stuck at home, they're unable to have kind of the social interactions that we all need to have. Those people, there's the mental health issues, as you brought up, as well as the kind of personal fiscal issues. I'm very concerned about the other fallouts that can come associated with just forcing people to stay at home for weeks on end without any sort of plan on how we're going to move beyond this. Either when we get beyond this crisis, or how we're going to live with the virus if it is going to be a part of our new normal.
Right. Okay. And again, I'm glad you stated that we are taking the virus very seriously. I know individuals who have contracted it. In some cases, they've been very serious, and others not as serious. So I think we're taking that seriously. And again, reiterating hand washing and not touching your hands to your face. A lot of people I know are starting to wear the face coverings out in public now, and so yes, we need to do this responsibly. But you have lives. Our lives are comprehensive, and that needs to be taken into consideration. I just realized on my phone I could see some of the comments, so it's not on my screen, so I may look aside from time to time. But do you want to take some of the questions that have been coming in? And again, we should be live on my channel and maybe yours as well. I just realized, so this is the first time I've done this kind of interview live with a colleague. So forgive me if we're working out some of the kinks a little bit here. But I didn't introduce you properly. So State Senator Dan McConchie represents is it the 26th district or 20? What's your district?
Yep, 26.
26.
Right.
So I'm on his channel now. So I'm State Rep Tom Morrison, 54th district. My communities primarily are Palatine, Inverness, Rolling Meadows, North Hoffman Estates, Western Arlington Heights, Northern I said that one, a bit in downtown Barrington, a little piece of Schaumburg. And then Dan, what are the communities that you represent?
So I'm north and west of your district. I represent Libertyville, Mundelein, go out to Crystal Lake, Long Grove, Lake Zurich, Barrington, South Barrington, Algonquin, Cary. I represent part or all of 34 different communities, just by the way those kind of gerrymandered maps that we have to deal with are lined up.
Okay. And you want to just share what committees you serve on in the Senate?
Yeah, so I'm one of the budgeteers. I work on the budget issues. One of the people we have daily budget meetings trying to deal with the emergency and crisis that we have right now. Also on insurance, education, higher education, telecom, and a couple others I'm not thinking right off. But budget is the biggest one that is probably the biggest time suck that exists in a good way, in an important way, and what that's really vital for our state.
Right. And again, for those of you who are just tuning in, um, Senator McConchie was talking about the impact as this shutdown has had on the economics of Illinois. Because for those individuals who say, "Well, look, we have to just stop this virus from being transmitted," um, if the state of Illinois budget has, we already had several $billion in unpaid bills before any of this started. We already had increasing pension payments before this started. We already had the worst funded state pension system in the country before any of this started. And this is going to have an impact on school funding. It's going to have an impact on human services funding. It's going to have an impact on college funding, and so community college and four-year school funding. And so these are the sort of things that we have to deal with as state legislators. We've had session canceled again for next week, so we don't know when we're going to be going back into session. But when we do, we're going to have to tackle some very, very massive issues in a short amount of time. And so why don't we just take some questions right now? If you want to put your questions in the comments section. And Dan, is there something that you saw? I'm going to look away for just a second, but why don't you read off a question that you've gotten over on your end?
Sure. One of the first ones that came through was, would I challenge this order if there were a Republican governor doing the same thing? And absolutely. The issue here is there has to be a balance of power. No governor should be able to operate with impunity without any sort of oversight. We all have a boss, right? We all have somebody that we report to, and we have three co-equal branches of government in the state of emergency. That kind of balance of power needs to be maintained, regardless of who's in the governor's seat.
Right, and so I'm broadcasting on my official channel and my campaign channel both at this time right now. But there were times when I went against Governor Rauner where I thought that he was wrong. And again, this is just fundamentals in our American form of government, that we have checks and balances. You don't want a president with too much power. You don't want a governor with too much power. And again, restate your legislation that you filed, because some people have just tuned in the last couple of minutes. So Senator McConchie introduced Senate Bill 3987. I plan to be a House sponsor of similar legislation.
Yeah, so what they would do right now, the governor is able to declare a state of emergency. It lasts for 30 days. He can renew that at will without any sort of input from the legislature at all. What my bill would do is say that anytime you have a subsequent declaration after that initial one that lasts for 30 days, anytime that those are going to be renewed and carried forward, you need to have the General Assembly weigh in and either approve or disapprove of those.
Every job is essential, is what one person said. And again, that's something that has bothered me when I hear about essential and non-essential positions or businesses. Is if someone only has, let's say someone owns a barbershop, that is their sole source of income. That's been shut down. Under the proposed new executive order, pet grooming is going to be opening. Is that what you understand? So pet grooming is going to be opening.
That's the rumor. We do not have the outline as to what it's going to be. That has not been released. My understanding is it would be released at some point next week.
Okay.
The actual list.
But, we're all still going to some of these retail establishments, grocery stores in particular. And so there is going to continue to be interaction, whether we like it or not. And so, we have to treat one another as adults, wear the face coverings, as a way of mitigating transmission. But, and again, take care to use hand sanitizer and wash hands and all that. But we also have a significant component of our state who needs to be working again. They need income. They need an income stream. If small business, having owned and run a small business myself, my parents did, my grandparents did. It is very, very difficult to start up and run a small business. Incredible challenges. And even though the federal government and the state government and the county has tried to introduce programs recently to try to support those businesses, we still know that the vast majority of them have not gotten any support. It is very, very difficult to even apply for those things. There are a lot of there's red tape that comes with it. And so it's something that we've got to address and quickly.
Well, and the fact is the government only has, the federal government can print money, right? The state government cannot print money, or limited in our ability to borrow money. So the ability of the state to be able to intervene and really kind of carry people forward is very limited. Here it is in our state. And so, it is simply a fact that, people have to be able to work. And I want to go back to the point that you made in regards to, essential, non-essential. At the end of the day, I really don't like that determination. I like the idea of whether it can be operated safely or not. Why is it that I can go to the grocery store and buy flowers, but I can't go to my florist, of which whenever I've been into my florist, there's maybe been one or two people in the shop ever at one time, right? They're not the high traffic places that you have a grocery store. Yet I can go to buy flowers at the grocery store, but I can't go to the flower shop, right? These types of things need to be treated with a lot more kind of openness and trust of people. And if you're concerned about getting sick, then it's very easy. Don't go out, right? And at the end of the day, I mean, the biggest thing that we have to be concerned about is ensuring that we are are managing the infection rate that is out there so it doesn't overcome the healthcare system, right? And as long as we're able to do that, I think we need to operate with as much openness, safe openness as possible, because again, indefinite shutdown, just like indefinite war, is just not is not a solution long term.
Do you want to take another question on your end?
Sure. One of the early questions is, help me understand why we have not heard one word from Madigan or Cullerton, and then talks about rolling back taxes. So you're right. There's been almost nothing said from the legislative leaders on the other side of the aisle that I have heard. I have not heard anything from Speaker Madigan. President Cullerton isn't there anymore. He did resign at the beginning of the year, and now we have Don Harmon, who's the new Senate president. We haven't heard a great deal from him either, though what we have heard has been, his advocating for a $40 billion bailout from the feds, including $10 billion for our pension system, which has nothing to do with the virus, right? And I mean, just before we got onto this call, on the news, we were being pilloried. Illinois was being pilloried in the press again for asking for tens of billions, for taxpayers across the country to spend tens of billions of dollars to bail out Illinois. It's unfortunate. We need to keep our own fiscal house in order and really step up in regards to that, not asking the rest of the country to bear our burden that we've been unwilling to address head on.
Right. And I mean, you and I both have been saying that for years, that Illinois does not have a rainy day fund. We basically, even after tax increases, new programs have been created. I typically vote against those, and I asked during the House floor debate, haven't we already overcommitted ourselves? Why are we creating this new program? But Illinois has virtually no rainy day fund to speak of, and so while states around us can absorb this hit, as they've been hit too, they've had businesses shut down, they've had economic activity clamped down, but we're in a far worse position to deal with this because we've been resisting, we meaning the state as a whole. There are individuals of us in the legislature who've been working very hard to try to be more responsible in terms of our budget and our spending priorities, but here we are. And so let me just go to a question here, and I'm not sure if this is one of your constituents. We're combining our feeds here, so I'm not sure if this is one of my constituents or one of yours, Dan. Where did it go? Ruthie asks, are you saying that the governor has authority to extend the emergency past 30 days? And was it Thursday or Friday, a state rep from Southern Illinois actually filed a lawsuit that challenges that order. I don't know how that's going to play out exactly, but we do know that at least a lawsuit has been filed, and I don't know who has signed on to that or not.
Yeah, so the important thing that people need to understand is that the statute, the law in regards to this is silent. What it does is it says that the governor can do a state of emergency for 30 days, but then it is silent in regards to any sort of subsequent amount, which is why you have the lawsuit that's being brought forward. So some people are arguing that because it's silent, he doesn't have that authority. He certainly believes he has that authority, and that's why he is continuing to operate. Typically, when you file lawsuits, they tend to take a while, right, to work their way through the courts. But regardless of what the resolution is, there needs to be some clarification in the law as to how we would go forward, assuming this crisis comes back in the fall, as is being projected by some mental health, by some public health experts, or if it, we have some other emergency that comes up down the road. This is not going to be the last time that the governor has to issue a state of emergency about something, right? Things are going to happen go forward. Now that we recognize this problem, this concern within the law and this gap, we need to step up and address it.
Okay. So Brian Green asks here, what happens if I refuse to wear a mask in public?
So my understanding is that these things will be locally enforced. That this would ultimately end up becoming the decision of your local town, your local law enforcement, but also your local business. I mean, if I was operating a business and somebody was to come in without a mask, they are completely within their right to ask that person then to leave their property if they believe that person is behaving in an unsafe manner and either exposing themselves or their other customers to risk. And so, I think that it's important that what we do at this point, everybody from the president on down, right, who is out speaking publicly on this, says that covering your face is helpful to ensure that you aren't, if you're positive, you aren't spreading the disease to somebody else. It's just part of being a responsible citizen in this current environment. That's what I'm going to do if I go out in the public, and I would encourage everyone else to do that as well.
And I was talking with another colleague of ours, Representative Mark Batnick, about this topic of, and by the way, when we're talking about so this is an N95 mask that I had in my garage. It's probably several years old, but this is what there was a shortage of and are being mass produced. Now they're being disinfected so they can be reused. At some point, the elastic breaks down. But I want to clarify the difference between a mask and a face covering. And so one of my constituents started sewing these, and so this could actually just be t-shirt material. And again, this prevents think of it this way. If someone's going to sneeze or cough, would you be rather that they wear this or nothing? And that's the idea, is that you're just going to slow the rate of or just prevent unintended transmission of a cough or a sneeze and the virus that might be contained within if you happen to be sick or vice versa. So we're talking about these differences. And as I was talking with Representative Batnick, he was saying, think when you go into a restaurant, there's a sign on the door. It says no shirt, no shoes, no service. So in that sense, the government is requiring you to wear an article of clothing for the public health. And so this seems to be an extension of that.
So let me go to a couple of questions that I see here having to do with the legislature. One was asking when the legislature may come back and kind of what will happen, what will our work be going forward. We are one of the kind of very few states that concentrates almost all of the power of the legislature within the hands of the legislative leaders, Speaker of the House in the House and the Senate President in the Senate. They are the ones that determine when we come back to session. There is no way for us to meet unless the legislative leader of that body calls us in, or the governor calls a special session. That's the only way that we can be compelled to come in and lead. So, both Representative Morrison and I have been working every day here from home, trying to do the best that we can within the current environment. But until the legislative leaders essentially allow us to come back to Springfield, we are not able to then act going forward. And I don't know what's going to happen, what that's going to look like, even when we do come back. We have a lot of working groups here in the Senate. I know the House does as well, trying to work on things, especially the budget. I have daily budget calls every day at 9 a.m. that often go for maybe a couple hours at a time. And, so there is work that's being done. As far as the work of the legislature, we constitutionally have to end the legislature, the session ends on May 31st. It doesn't mean that we can't continue to do business after May 31st. It just means that the threshold for votes goes from a simple majority to a supermajority, goes to a 3/5 majority. So it just makes things a little bit harder to get done. But in a time like this, I think it's helpful and useful for us to be coming together, not only in a bipartisan manner, but in a supermajority manner, try to get the people's work done. And so I'm not concerned about. We'll be doing a budget. How much else? There's going to be other emergency things that certainly need to get taken care of. Will there be things that would be normal business that we would have gotten done that we won't get done that'll get punted to next year? Sure, but that's understandable in the current environment.
Mm-hmm. All right. So if this is something that you enjoy, we were going to talk for about 30 minutes here. Again, we have separate districts. We don't overlap. Normally, there are 2 House districts nested within each Senate district. But Senator McConchie is a friend. He is we've known each other for many years, even before either of us was in the legislature. And so this is why we wanted to have this joint conversation, is just let all of you at home know in our respective districts that we are paying attention. We're very concerned about the situation. Again, from the health and medical aspect of it, but also the economic aspect of it as well. And that's why Senator McConchie filed his bill, Senate Bill 3987. It's up on your website. You want to just give your website location, or where can people read that bill?
Yeah, so you go to senatormcconchie.com. You can see how to spell my last name there at the bottom of the screen, senatormcconchie.com. Just go to the bottom where it says news, and that top link there, you can click on that. It gives a summary of it. Go to the bottom, you can click actually read the legislation in itself.
Okay, and if you wanted to contact me, my website is repmorrison54.com. You could also email me at morrison@ilhousegop.org. And I'll continue to, even after we sign off, I'll continue to read your comments and try to answer them. During this broadcast, I've noticed several federal-related questions. Again, Senator McConchie and I, we are state legislators. We had no influence on the federal legislation that passed or is being discussed and debated. But we can try to direct you to your respective congressman, or we're all equally represented at the U.S. Senate level. But our area of responsibility is state of Illinois, and so we're going to do the best we can to address those concerns as they come in. Like, for example, the unemployment insurance issue. While our office has tried to help people with their applications, ultimately that agency is run by Governor Pritzker, and so some of the snafus that have been run into, that's the governor and his team that has to fix those problems. I mean, we've been passing up suggestions, recommendations, been trying to help out in that way, but again, there are certain things that the executive branch is responsible for, and the legislative branch. We introduce bills, we vote on bills, and then we're also sort of that go-between between Illinois residents and their state government. So if you're running into some bureaucratic issue, you can contact either one of our offices, and we will try to help you. We'll try to cut through some of those bureaucratic obstacles within state law as it exists. And so anyway, anything, Dan, thanks again for joining me. Any closing comment before we sign off?
Representative Morrison, I know have known for years, does a really great job at representing you to Springfield. I know that if you have issues of concern or some problem that you're having, please do reach out to his office, and I know that him and his staff will do everything they can to try to cut through the red tape and help take care of you. Same thing with my office. If you're having issues, always glad to hear from you, and we'll do what we can to help you out as well. Thanks, Tom, for having me on. It's been a lot of fun.
Yeah, and again, if you're watching and if you want us to tackle a specific topic on a future broadcast, put that in the comments section as well. I'd be happy to do that. I've been doing a number of Morrison Report videos where I'm interviewing, again, medical professionals, but also those who lead our social service providers at the local level. But then also I've been interviewing local business people on their perspective. And so if you have someone that you'd like to see interviewed, and Dan, as I learn this technology and how to do this, I'd be happy to help facilitate this for you or any business or human service provider in your district as well. This is just a very...
That'd be great.
Yeah, this is a good way for us to interact with you, and I hope that we can be of benefit to you during this time. So thanks again for watching, and we're both going to sign off now. Again, we'll try to answer those comments as they continue to come in. Enjoy the day, everyone, and thanks again for tuning in.